The other issue that we've been talking about is that elderly patients are very different geriatric. That's why there's a specialty called geriatric medicine. Why? Because it's a specialty. That's why. Every organ of the body in a geriatric patient is fragile, is very fragile, especially the liver in comparison to a healthy liver, the kidneys in comparison to a healthy kidney. Well, the heart comparison to a normal heart, lungs comparison to a normal patient's lungs, brain comparison to a normal patient's brain, and so on and so forth. Aging also means that last year you were healthier than this year, and then last year you were healthier than this year. You're going in this direction. That's the natural process of aging. Unless you are doing something proactively to either prevent that or even do this, go this way, which is what we are working on doing for you in our business, in our practice. Hospitals Without Walls and all of its associated fields and businesses, right? Otherwise, whoop, that's where it's going. So the trajectory, the direction, the vector is this way. And we need to make sure that you are getting somehow healthier. Otherwise, you're going to be getting less healthy in every organ. Now, it's very important that if you are taking multiple medications, that you need those medications. And if you don't, we need to diminish or reduce the number of medications to the bare minimum. Why? Because your body has to process those meds. What is processed? It's called metabolism. It has to break it down. And then because they're chemicals, they're putting tax. They're taxing your liver. They're taxing your kidneys. They're taxing your whole entire system to process all these chemicals and then get rid of all extra, byproducts of the chemicals out of your system. Well, guess what happens when you're older? It puts tax, it puts pressure on your body. Your body is already having a hard time to even process food, let alone all the chemicals that are lingering around. First of all, it impacts the system. For example, people who are taking Valium at a young age, Valium or byproducts of the Valium, diazepam, for example, diazepam is a family, benzodiazepine. Benzodiazepine at a young age, okay, they get a little bit of dizzy, they get but groggy, they get a little bit relaxed. Okay, nothing happens. You take that at an older age, you start hallucinating. You start seeing things. It really impacts an elderly patient. If you have a family member, elderly beloved patient that is actually on benzodiazepine, that patient is going to have a problem. So benzodiazepine should be taken off of the regimen most likely and it be replaced with something else. Why? Precisely for the reason I explained. Because the system cannot process that and then it lingers around for a very long time. It affects their mentation, their thinking, and it affects their brain functionality. It affects their whole entire function and then also affects their ambulation, walking. They end up falling. And what did we talk about falls? Catastrophe, life threatening. It could kill a patient. Hip fracture, and someone who has a hip fracture 10 times higher risk of death that first year than someone who did not have a hip fracture. Disaster. You can't afford it. Done. Okay? The other one is narcotics. Okay? Narcotic medications. Narco. Any kind of codeine family. Okay? Oh, people popping Tylenol with codeine like it's candy. What's that about? No, it's not candy. Okay, you have pain, I understand. But any kind of medications that's from that family, opiates, is a danger to patients. Elderly patients can't process it. When they do take it, it takes a very long time. The clearance time is very long. It's not like a regular young patient. If it takes the half time of a medication in a young patient and an elderly patient is not the same. Half time is the amount of time that it takes for a young patient to take that medication to half the dose than the amount of that medication in the bloodstream than a older patient. Well, that is very extended in an elderly patient. If in a young patient it takes 4 hours, in an older patient it may take 24 hours. Now you take your second dose in 8 hours, that just extended to 48 hours. You take your third dose in 8 hours, that just extended to 64 hours. It's compounding now. Boop, 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 boop. Imagine what happens. It says take it every 8 hours, right? You're taking it like it says. But now it's not clearing like it did when you were, 24 years old. It's because it's just the halftime. So it's just compounding. Boom, boom. It's staying in your bloodstream longer. So now it's just compounding in your bloodstream. It's staying on board more and more before it clears out your system. So now it's lingering around longer. So you're walking around like as if you're drugged. That's what happens. Now imagine you're drugged, walking around, driving around as an elderly patient. Guess what? You're at risk of all kinds of things. Get it? Now imagine you've got multiple meds on top of that. Disaster. Diazepam, family meds, right? Meds of diazepam family, right? Then you have meds of opiate family. Then you have medications of all the other kinds of families, right? That are going to linger around. You're just the laboratory of medications walking about. And these things are catastrophic. Do you understand? That's why.